So we can correlate the electron poison curve with the cardinal positions of gaze. And electrolytes, cations in the body quadrants, as we see the calcium, magnesium, sodium, potassium. So by the way, we know that calcium, magnesium has to be in balance, and they are on the back side, and sodium, potassium in balance on the back side with the front side. And this electron poison curve can shift according to calcium, magnesium balance or sodium, potassium balance. And you can see changes in muscle balances like we're talking about. It's reflected in the body's reflection of the electron poison curve. And these do have actually effects on that make sense with the rest of the concepts of body chemistry. When you put those four minerals in those quadrants, they fit with a number of other concepts of what happens in intercellular chemistry.
If a patient's taking like a calcium magnesium product or a multi-mineral, how could that affect that goal?
Well, if a patient's taking a calcium magnesium problem, what it will tend to do is it will tend to increase the calcium, so it will tend to increase the front muscles on the right, and tend to increase the magnesium, increase the back muscles on the left, and it will tend to shift them in a direction where the curve would move this way, which will be really useful if they're stuck like this. So it shifts them this way. Now this is talking what you see in the electron poison curve and some musculoskeletal awareness of the different minerals. There are other reasons you might find a need for some of these minerals. This is not the only way to find it, but this is another way that might give you a clue as to why patients have sometimes difficult problems and what to do for them. So yeah, that's why sometimes calcium, magnesium are better than just calcium or magnesium, because the patient's body is shifted and their electron poison curve and the body chemistry is shifted like this, and you give one, you get part of the response, but if you give them both, you bring the curve back to normal, you bring the body back to normal. So that's why also sodium, potassium are in a balance, as you know. And so that fits there, fits that pattern. So we have these 6 cardinal positions of gaze. Well, guess what? Each of those positions of gaze can be related to one of those minerals. So, 4 of them at least. If you move the eyes up and to the left and it strengthens, they might need magnesium. Down and to the left, they might need sodium if this strengthens them. If you move the eyes up and to the right, they might need potassium. If you move the eyes down and to the right, they might need calcium. In other words, if they strengthen when you move the eyes up and to the left, they may need magnesium. If they strengthen when you roll the eyes down and to the left, they might need sodium. If a weak muscle strengthens when you move the eyes up and to the right, they might need potassium. If the weak muscle strengthens when you move the eyes down and to the right, they may need calcium. And you can use this sometimes as a tool to identify when a patient needs a certain mineral, and you'll usually find a weak muscle in that quadrant that relates to that mineral as well. Again, this is just a little bit of a side, but it's all related to what we're talking about. And if you find a patient who has one of these problems, you see that the thyroid and the steroid, are related to both right and left lateral movement, which makes sense from what we talked about before. But if you find a patient that has one of these problems, they have a calcium problem, they might need more calcium, but they might have a problem with metabolizing calcium. They might have an adrenal problem or a parathyroid problem or something like that. If they have a problem with potassium or sodium, they might have an adrenal problem. I mean, all these things can be secondary to some other endocrine problem or something, but they are useful for sometimes we just have a frank deficiency of a certain nutrient, and you'll find the pattern of weakness in that quadrant, and it'll tend to recur, and that's where the most usefulness of this concept is. The eyes can be useful in identifying that, but simple muscle testing will sometimes just give you the clue. You know, don't you have patients who they've always got a weak left latissimus dorsi or something, and then check them for magnesium? Yeah, question?
I was just going to say about the vitamin D and then the vitamin F for helping the
Right. The other, she mentioned vitamin D and vitamin F, the fatty acids. If you have a problem with any of these minerals, you can look at the endocrine system factors that help to regulate them, and also the other nutrients, especially for calcium. Yeah, it's a good point. Thank you for saying that. Vitamin D and fatty acids, which also help regulate calcium. So body quadrants and eye positions in the cations, if the eyes up and right strengthen, they may need more potassium. If the eyes down and right strengthen, they need more calcium. Eyes up and left strengthen, they may need more magnesium. Eyes down and left strengthen, they may need more sodium. Eyes straight to the left strengthen, they might need steroid activity. Eyes right to strengthen, they may need more thyroid activity. But remember, we said that we've got to fix injuries first because the eyes will go to the direction of the injury, and we talked about that before. So this is like sort of a secondary thing. It's not the thing you start with. If you got the injuries fixed and you've got some of these other factors that we've talked about in the brain on fire, and basically just the basic QA protocol patterns fixed, then a lot of these things will be useful for recurrent type problems. So if you have a lateralization of the eyes strengthening, it could be a thyroid or a steroid, but it could be a It could be something that's not related to the adrenals or the thyroid or the reproductive. It could be related to an injury or a set point or even a subluxation on that particular side of the body. So you have to take this into context, but there are times when it really pays off, looking at the way the body is hooked up to the body chemistry. So we have these again, the 6 positions of gaze and the electrolytes. So rubbing the skin over one area of the body's quadrants will rubbing the skin over one area of the body quadrant that you identified by the eye position will negate the brain Chapman's reflex challenge. Actually, that's not what that's supposed to say. Rubbing the skin over one area of the body quadrant that was identified by rubbing that whole quadrant. In other words, you rub over the whole quadrant. We're going back to the brain on fire now. Chapman's reflex therapy localizes with a stressor, and turning the head to the left negates it, negates the weakness. So we just sort of rub up and down the whole area of the spine, or anywhere around to the side of the body, anywhere down to the foot, to the top of the head. Start with the spine, it's the most common, until you find the area that strengthens that weakness, and then you have to narrow it down and find out what specific area, even to the point of being one vertebra or one point, that will negate that weakness. And it shouldn't say the eye position there. So possible lesions that are creating the brain on fire and perpetuating it pattern: subluxation, a fixation, unusual pattern not associated with bilateral weaknesses, and you must challenge it because it doesn't have the bilateral weakness. Set point technique or LQM technique, or injury recall technique, but it should have already been corrected. Correcting the lesion will negate the brain Chapman's reflex challenge with the cytokines and neurotransmitters or neurotransmitters, and the patient will usually require previously identified neurotransmitter and cytokine nutrients. So you make the correction, but you still have to supplement the patient with what you found earlier for the either neurotransmitter or inflammatory process.